I will be presenting my case about neuromuscular system, specifically central nervous system stimulant, and I will be screen recording so that you can all understand it while I present it. So this is our case. After a month of treatment with Pemolin for attention deficit disorder, a 9-year-old is to be reassessed to determine if treatment with the medication should discontinue. Discuss what information and observed behaviors would indicate that the Pemolin should be continued. Case facts. Patient is a 9-year-old with ADHD. Patient has been taking Pemolin for a month na. And hindi ko lang nalagay, patient is for reassessment. So yung pasyente natin is bumabalik sa hospital. Discuss what information and observed behaviors yung would indicate na dapat itigil na natin yung gamot. ADHD, little background about the disease or the disorder, attention deficit hyperactivity disorder that makes it difficult for a person to pay attention and control impulsive behavior. As of now, wala pa tong cure, but commonly treated with medication, training, and therapy. Ayan, yung ADHD patient, they have low level of neurotransmitter dopamine. So, yung dopamine, it helps us regulate alertness. Ayan, yung symptoms naman ng patients with ADHD, inattention, hyperactivity, and impulsivity. Inattention, short attention span, madaling mawala yung focus. Lose things more often. So, sa mga bata, nawawala yung pencils nila, yung books nila, and avoid or dislike tasks that requires mental effort. Ayan. Hyperactivity, yan, fidgeting and squirming, talking non-stop, hindi mo talaga mapigilan. Impulsivity, acts without thinking. Patient with ADHD, usually they are referred as rude and mean to others, but in reality they do not control what they are showing others or saying to others. Hindi nila ginusto na meron silang gantong disorder. So dapat tayo bilang normal na tao is dapat iunawain natin sila and bigyan natin sila ng mas maraming pasensya, especially sa mga parents nila. Yan, struggle to wait for their turn. Yan, Pemolin, yung gamot, CNS stimulant siya, stimulates the brain, speeding up both more mental and physical processes. Ayan, used to treat children with ADHD, increase brain chemical dopamine and norepinephrine. Yung dopamine regulate alertness, norepinephrine helps regulate movement, attention, and etc. So, Pemolin is second-line therapy. Hindi siya first-line because it sometimes result in life-threatening hepatic disorder, and patient with normal liver function test lang yung pwedeng mag-take nito without liver disease too. Ayan, yung adverse effect, growth retardation, decrements in predicted growth. So, children with are supposed to grow in this specific height or weight in this specific age, pero they are not growing. So, next is behavioral disorder. Exacerbates symptoms of behavioral disturbance and thought disorder. Parang nangyayari to kapag repeated yung administration ng gamot natin. And study shows parang nag-conduct ng animal experimentation and it leads to eventual expression of life-injurious behavior. So, ano ba yung information and observed behavior that would indicate that Pemolin should be discontinued? So, patient taking Pemolin are at high risk of developing liver failure. So, is this information enough para itigil yung gamot? No. Di po pwede kasi reseta siya ng doktor. Pinag-isipan siya, and if the drug is doing more harm than good to the patient, it will not be prescribed by the physician. So, next is, assume natin that the patient is undergoing a liver function test. Yan, malalaman natin if yung patient is nag-undergo niyan, para malaman if yung tinatawag na serum aminotransferase ay nag-elevate siya 2 to 3 times higher than the limit. So, kapag tumaas siya sa upper limit, it must be discontinued. Yan. Observed behaviors naman, ayan, kapag nakita natin yung behavioral disorder such as eventual expression ng self-injurious behavior sa patient taking Pemolin, dapat itigil na siya. And appearance of signs of liver dysfunction such as jaundice, anorexia, GI complaints, malaise, ayan, tics or Tourette syndrome, yung panginginig ng ating kamay. Ayan, uncontrolled speaking and moving. That's all.